Hello, hola. So, thank you for joining us again. We have a nice case, and I wanted to show you a little bit again how we can deal nowadays by endopathology um, with gastric varices. This is one of the big new therapeutic, you know, that we can do it. And I believe the results published until now, I recommend you to read the last meta-analysis made it by Christopher Thompson and Marvin Ryu, where we can see really how these kind of techniques can deal with gastric varices in a better way. So I think this is this needs to become the treatment of choice for this kind of pathology now. So I am with 19 years old female with autoimmune cirrhosis, right? Liver cirrhosis because of autoimmune hepatitis. Okay. So what I'm trying to look here is to follow my vessels. You see? So I see the gastric varice here. So it's here. I put water. I love to put water always, just to see where it is. And I move my scope just to see and to follow up and to see where it's coming, these gastric varices. So I need to see the feeder vessel. This is a big question that always everybody asks me, how you can see the feeder vessel. So for my experience, I just move right and left as I am doing now, and I try to see if there is any kind of connection. Okay. Voy a decirlo en español para los amigos de habla hispana, a petición de la doctora Gauto. Ah, Hoy en día el manejo de varices gástricas creo que debe ser realizado por los estudios que han sido evaluados, incluyendo el reciente metaanálisis del doctor Rio y el doctor Thompson, demuestran que realmente es mucho más efectivo a largo plazo. En el último trabajo nuestro en DDW mostramos que efectivamente ah, los resultados a 8 años son mucho mejores cuando hacemos una terapia combinada, y esa es es decir, la conclusión del estudio también de ellos. Entonces, lo que estoy viendo aquí es que posiblemente hayan dos vasos nutricios, ¿ok? So, I think there is two feeder vessels here. So, I am following this one. You can see here. So, the communication is here. But there is another one up. Se lo voy a explicar mejor. Hay un vaso abajo que nutre, que es este que está aquí. Quiero que lo sigan. Ok. Este es uno. Entonces mi feeder vessel está aquí. Y el segundo está aquí arriba, que es este. Entonces necesito hacer un doble abordaje. Esto puede ocurrir en el 30% de los casos. So we have two feeder vessels. This one is up, where you see the pointer, and the second one is here down. Is this one? Are not communicated one with the other one. So I need to start with the distal part with this vessel, and then I will do it the second one, the upper. Okay? Because once I put the coils, I will not have access. Well, I will not see very well the upper one. Okay, so I will go deeper first, and then I will go more superficial. Okay, so now I will pass my needle. Okay, estoy dentro del vaso. Ok, siempre hago una aspiración para ver que estoy dentro del vaso. I'm inside the vessel, and now I need to flush with saline solution. Ahora necesito salina. So I need to see where the bubbles goes. You see? So is going in this direction. Va en la dirección hacia arriba. Significa que estoy bien, pero estoy en un vaso muy superficial porque este que está acá, cuando hago el flush, este es el que se llena, pero este no. Entonces hay dos vasos. ¿Ok? So now I need to go deeper. Dame más salina. Pareciera que comunicara, ¿no? Bueno. No comunica. Okay. So now. So I see there is no communication here. So I will go deeper. I am very superficial. I will come back for this vessel. And now I need to go deeper. Okay. Ahora voy a ir más profundo porque necesito irme sobre este vaso que está aquí. Estoy girando un poco mi... Está muy lejos, ¿no? Okay. So I'm a little deep, you know. In theory, I am inside. Okay, dame para aspirar. So now I am in the deep vessel. That is the second. No, I'm not. Esto está en aspiración. So now I'm inside, you see? Now I'm well. And now I will flush again. Quiero salina. Oh, this is better, you see? This have a communication app. Dame de nuevo. So this is better. So maybe once will be enough, you see? ¿Ustedes ven? Ahora voy a hacer contraste. I will use contrast to make a varicelography. And now you can see very well, you see, the left gastric vein, más. Very well. Okay, so now I will put some coils now. Salina. I will flush with saline first. Okay, and then I will use a coil. So, ¿de qué tenemos? ¿De 20? Dame una de 20. So I will use one 20 millimeter of diameter coil. Un coil de 20 milímetros. Me retira. So now I use the stylet to push my coil. Empuja. So now my assistant will push because I am in a difficult position. Okay, empuja, empuja, empuja. Sigue. Sigue, sigue, sigue. So it's becoming hard for her. It means it's very good, the diameter. I'm not worried about that. Sigue, 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 sigue. Si coges una gasa, lo empujas más. Ok, si retiras un poquito, con un poquito de salina, y ahí lo vas a poder. So when it happens, I think I do already a thrombosis. You see, I'm not see more flow here. So it was a good election. Maybe. See? So what I do is remove a little bit the needle, and she arrived to push more. You see? Now she put very well. Okay. Saca. So I think I do it well here. And now I will do my glue here. I will do a second. This is the second vessel. I want to see where is the communication here. Let's see here. Okay. Here is not so bad. So let's see. Okay, esperemos. So now I am well. This is very important. When you see there is the endothelium going up, it's not good. So now, trying to see if I am fine. Then again. So it's a very high volume here. So now flow. I need to put here my needle. problem sometimes is we are in the 2D mode. We don't see like a 3D, right? So I need to be sure to be in the right vein, in the right vessel. And sometimes it's not so easy, huh? Okay, now, aspiremos. I think I'm fine now. Está tapada esta aguja. Dame salina. Un segundo. Dame un segundo. Posible que no está. So, I think está tapada. So my needle is... La aguja está tapada. Necesito que pases el mandra. So the needle is with cloth. So now I need to remove the cloth. You see? Ahora sí, empuja. Tu aguja está tapada con coágulo. Ok, ahora sí me da salina. Sí. Ok, retira. Y me da salina. Now I will do a flush now. You see? Now it's doing well. Okay. Ok, dame un coil de 10. Ok, uno de 12. So I will put one coil of 12 millimeter. And you can see there is two vessels. So this vessel is in another position, right? Dame contraste. I think it's another position. Oh, this is the left gastric vein, you see? So I will put here a second coil, salina. Dale. I will remove. Empuja. Ok, ahora sí. Dame salina. I think I'm very good. Okay, regálame. Las ampollas de cianoquilato. Déjame ver. ¿Cómo? Sí, está bien. 6. So I will put the glue now, because now I am in the left gastric vein. So I block it up and I block it the left gastric vein, and I believe this will be fantastic. Entonces ahora vamos a poner la cola. 2-octilcianoacrilato. Ok. Toma. So now I will confirm there is not more flow. So it's perfect. And I want to see how is everything here. So I'm not worried because this is just. And I will see here. I will try to see, I think it's coming from here. But I believe I do a blockage down, so it will be fine. Just in case, I will confirm now. Dame. Sí. Okay. I'm again here. Ahora sí voy a necesitar solución salina. Y necesito contraste. Okay, now. You see, it's coming from the other side, other branch. It's another branch coming down. So it's. Salina, dame un coil de 12 y prepárame las otras ampollas de cianoacrilato. So I will put another coil. So I will put just one coil and more glue. That's all. And we will finish. Okay, la tira. So it's easier, es fácil. Solo hay que tener una perspectiva un poco más clara del flujo de los vasos. It's very important to have a good perspective of the flow of the vessel. So I will put this one. Empuja. Salina y las ampollas. So in total I put it 3 coils, right? So I flush with saline Yo siempre hago un flujo con salina para que la sangre no se regrese. Y luego pongo la cola. And then the glue. Okay, perfect. So now, so now we don't have more flow, and there is not more gastric varices. So we complete, remove, and this is the big advantage from US to other techniques. You see? No more gastric varices. Now I will pass the gastroscope just to confirm. Voy a pasar el gastroscopio para confirmar. Y listo. ¿Están de acuerdo que la técnica convencional no funciona bien que esta, verdad? Bueno, aquí hay un consenso mundial. This is a world consensus, right? Consensus. World consensus. Colombia, United States, Mexico, Peru, Paraguay, and Ecuador. And Venezuela. Where is Venezuela? So everybody agree. ¿Concuerda que la técnica convencional no? ¿Ah? Hasta Fabricio, que es de la zona, enfermero estrella de las zonas altas, de los barrios periféricos de Guayaquil. So now I will pass my scope just to see. Respiración. So if there is any bleeding, so don't worry about that. It is normal. I want to clean better. So this is the way where I came inside. This will stop for sure, so don't worry about that. If it doesn't stop, you put a clip or you put a so this is the gastric varice. And that is why, so we have two gastric varices. One was this one, and the second one was this one. That's why I had to do it in different areas, because there were three branches, to my opinion. So now it's disappearing, right? Ahora desaparece. And when I see that it's a little bit white inside the gastric varices, it's because I do a good treatment. This is another sign, at least by endoscopy, right? So this patient tomorrow will not have more varices and will be fine to go home. Desaparece, ¿verdad? Sí. Okay, so I'm happy. I think I do it a very good job. And now I will remove the air. I will do a band ligation here now. Prepárame bandas. So you can do a both treatment in the same session. There's not a big problem for this, okay? So we need to treat this and then we will finish. So I will do a band ligation now, just in this distal part, and we are almost done here. So now I will use a band ligation from Mycotech, one of our biggest sponsor. Okay. And this patient needs to be under treatment of beta blockers, okay? So this is the big recommendation, because the risk of reappearance in the multivariate evaluation analysis that we had is that patients with beta blockers doesn't reappear the varices after 8 years of follow-up. Después de 8 años de tratamiento, de seguimiento, no hay reaparición de varices. So the bands from this company is white, it's yellow for sorry, like the best team of the world, Barcelona of Guayaquil, right? Yellow. Everybody agree. Todo el mundo concuerda, ¿verdad? Okay. So my fellows, they say that it's okay. El mejor equipo del mundo, Barcelona de Guayaquil. The best team. I will do a band ligation, right? Maybe I will start here. Ok, perfecto. Very good. Muy bien, ¿no? Okay, we finish. So when you see the black one, it's because it's 2 more shots. But I believe I finish here, okay? So this patient will be fine.